Strain on some California medical workers is going from the breaking point to the picket line. Nearly 2,500 nurses in Southern California say they will strike Christmas Eve through January 3rd, and they say it's because of poor work conditions and inefficient planning during the pandemic. This is a strike that will impact these three hospitals right here, and the nurses there say that they have now declared, quote, an internal disaster, or pardon me, the hospitals have an internal disaster and will now limit their services in order to ensure there are enough nurses to care for patients with the highest needs. I want to talk now with rapid response nurse Erin McIntosh, who works at Riverside Community Hospital. She is also a bargaining team member of the local nurses union there. Erin, this is serious business, striking during a pandemic. So tell us what your demands are. What has brought you and these thousands of nurses to this point?
So our demands are simply safety, accountability, and staffing. Our issues, we want to make it clear that our issues existed long before the pandemic hit. We estimate that last year in April, we were 340 nurses short. And the pandemic has just exacerbated those issues.
Okay, so I just want to be clear, you're not asking for money here?
So our demands are mostly safety and accountability. Yes, that's correct. I know that HCA comes across, they just want to offer us more money, but our community, we feel, deserves better.
Okay, so money is part of the demand, but that's not enough. Is that what you're saying?
Honestly speaking, I don't think any amount of money values what the nurses have been put through, but we're not asking for money. What we really want is safety and accountability.
Okay, so we know that some of your complaints have to do with not enough testing, unsanitary conditions, and a lack of protection for nurses. So let's go through that. Testing. How often are you getting tested? How often are nurses being tested?
So currently right now, I think that we're being tested if we need to. I think most of our issues, I'm not sure where you received that information, most of our issues strictly are about unsafe staffing. Our nurses are being put out of ratio and being given an unsafe assignment. So due to Governor Newsom's waiver, which allowed nurses to take on more than they safely could, the hospital is given a pass. What that means is the hospital doesn't have to respond to any fines, and nurses are being told that we have to take on more than we safely can, all the while still being disciplined, unsafely taking care of our patients and putting our licenses at risk.
So that is the concern. So what do you want to see put in place for protections then?
So mainly we want more support. At a time when the pandemic hit, HCA made cuts to travelers, cuts to per diem staff. They removed charge nurses from bedside care and placed them in management positions. We want people to start showing up and helping, throw on a pair of scrubs and help us out so that we can safely take care of our patients.
Okay, so you want the numbers increased, which, as you said, was a problem even before the pandemic. Your hospital did release a joint statement with other hospitals involved in response to the impending strike, and this is what they said, quote, given the current COVID-19 surge and the national nursing shortage, it is unconscionable that the union would urge nurses to abandon the bedside and ask them to sacrifice wages from several lost shifts. It is also surprising that they would take an action that may endanger patients, a decision that their own constitution and bylaws state they should make every effort to avoid. How do you respond to that?
So I respond to that in that HCA has put us in this position. When the pandemic started, they made cuts in staff, they short-staffed us, they continue to flex staff home when we need help. So basically what I'm saying is they have recorded record profits at a time when we need more help. We just need more support.
Erin, thank you so much for coming on and talking to us about this. We know that what you're doing is getting a lot of attention, and so we really appreciate your perspective.
This really did come as a moral and ethical dilemma for all of us nurses, but we have to take a stand for our patients in our community because they deserve better.
Yeah, we've heard some of the complaints from nurses represented by your union. They feel that actually many of them have been infected. I know that some at your hospital have died. There's concerns about infecting patients who didn't come in with COVID as well. This is a very difficult time for hospitals, and we thank you for the work that you do. Thank you.
Thank you.